In contrast to the UK healthcare system, which has historically been hospital-centric, the New Zealand system places a greater emphasis on primary care, with general practitioners serving as gatekeepers to specialist care. While hospital services in New Zealand are free, patients are required to pay for GP visits, with fees varying depending on the patient's age and geographic location. This co-payment model was established in the 1940s after the New Zealand chapter of the British Medical Association opposed the Labour government's proposed Universal Healthcare Act in 1938. Fast forward to 2023, the GP practices in affluent areas charge higher fees, while those in poorer areas offer nearly free services. Despite this, both sets of GPs remain underpaid due to arbitrary government caps on how much they can charge patients and random decisions regarding co-payments. GPs must see as many patients as possible to remain afloat, leading to a first-come, first-serve booking system rather than a need-based one. Coupled with free visits for patients under 13 years old, which is also a randomly decided age that has been slowly creeping up every election, the result is an overwhelming burden on GPs and GP nurses, particularly in rural areas where nurse availability is limited. New Zealand GPs have the highest burnout levels among wealthy countries in the pandemic era, per Commonwealth Fund survey. 57% of younger and 40% of older GPs report burnout, while Switzerland reports the lowest rate of 13%. New Zealand's regional health board-run hospitals are not without a history of both patient and staff abuse. In 2022, a Royal Commission inquiry exposed shocking accounts of physical, sexual, emotional, and medical abuse endured by mental health patients at various state care facilities. Patients reported being raped, over-medicated, and subjected to dehumanizing conditions similar to concentration camps. These abuses were carried out by evil staff members and included forced sterilizations, beatings, medical malpractice resulting in death, and cultural and educational neglect. The Kant avec Sade paradox described by Jacques Lacan suggests that there is a tension between our moral duties and our natural impulses, between the ideal of human dignity and the reality of our animalistic drives. This paradox can be seen in the case of violence and aggression towards hospital emergency department staff in New Zealand, which affects not only burnt-out staff, but also the patients. Despite all attempts to combat violence and aggression in the workplace, emergency department staff at New Zealand hospitals continue to be physically assaulted, verbally abused, and sexually harassed by patients. On one hand, emergency department staff have a Kantian duty to provide medical care to patients, to treat them with respect and dignity, and to prioritize their well-being. However, the reality of the situation is that some patients may act out in ways that are violent, aggressive, or abusive towards staff. This can lead to burnout and emotional distress among staff, who may feel alienated and disrespected by patients. On the other hand, the patients themselves may be struggling with their own impulses and drives, such as anger, frustration, or fear. These natural impulses may be exacerbated by the stress of being in a hospital emergency department and may lead them to act out in ways that are harmful or disrespectful towards staff. According to the law, healthcare in our country is considered a fundamental right and should be universally available to all individuals, with equal access to the same standard of treatment. However, disparities in government funding across different regions have resulted in unequal access to healthcare services. An example of the disparity in healthcare access is that a wealthy individual residing in a particular neighborhood can travel just 5 minutes to visit a GP and pay half the fee compared to an individual living below the poverty line in another neighborhood just 10 minutes away. Unfortunately, the quality of care provided by GPs can be a hit or miss, with some healthcare providers being burnt out or incompetent, while others are willing to go above and beyond to give their patients access to specialist healthcare or secure funding based on their individual needs. In essence, it's a literal coin flip when it comes to accessing quality healthcare in New Zealand.